Welcome. My name is Dr. Mario Leyba. I'm a general and robotic surgeon here in Albuquerque, New Mexico. We're going to discuss several things today, specifically regarding patients, how to care for them in surgical wise, and how to make you feel more comfortable. I'm going to see you in my clinic. We're going to talk about things, but today we're going to give you some information so you can process, so when I see you later, we can have a good discussion. Thank you. The reason for making these videos was to help the surgical process along. I've seen it from a surgical standpoint. I know how to do the surgery, I've seen it in clinic and so forth, but I've never really dealt with being a patient. And when patients come to my clinic, oftentimes they're overwhelmed with the amount of knowledge that I give them and other doctors, and they focus on that rather than listening to what's actually going on. So when they go home, their family members ask them, well, what happened? A lot of times they're like, I don't remember anything. So the reason for this is to help educate patients and family members and even providers and other people that want to be involved in the surgical procedures themselves. What is a hemorrhoid? Hemorrhoids are abnormal swollen veins of the anus and rectum. There are different types of hemorrhoids, including internal and external. Hemorrhoids are very common. What are the symptoms of hemorrhoids? Internal hemorrhoids tend to bleed and cause itching, but are usually not painful. Most of the time, they're deep into the rectum and are not visible. External hemorrhoids, however, are visible and generally painful and cause some itching. Hemorrhoids can affect both women and men and are very common. Both types are usually caused by constipation or diarrhea, straining, sitting in the toilet for extended periods of times, and pregnancy, amongst other things. Hemorrhoids can develop very rapidly or gradually and can cause thrombosis. Internal hemorrhoids and external hemorrhoids. External hemorrhoids are when the hemorrhoids are outside near the external area of the anus. Internal hemorrhoids lie internally. There's a structure called the dentate line, which is this. Anything above that has no nerve innervation, meaning you can't feel it. Anything below that is very painful. Thus, external hemorrhoids can be very painful, while internal hemorrhoids usually are not. Internal hemorrhoids, however, can bleed. At the time of surgery, we'll distinguish between internal hemorrhoids and external hemorrhoids. Internal hemorrhoids are treated relatively easy with several methods. One method that I use is called rubber band ligation, where I put a rubber band around this hemorrhoid and cause it to fall off or necrose off, thus treating the internal hemorrhoid. This is done relatively easily with a anoscope or a little scope that is inserted into the anus to identify the hemorrhoid with a rubber band application. External hemorrhoids are a little bit more difficult to treat in that they cannot be rubber band ligated. Usually external hemorrhoids are treated with lifestyle modifications, hemorrhoidal creams, and symptomatic relief. If you fail that, then external hemorrhoidectomy or removal of the hemorrhoid in surgery may be offered, although this is very painful and usually a last resort. How are hemorrhoids treated? Most hemorrhoids can be treated by avoidance of precipitating factors, hemorrhoidal creams, lifestyle modifications such as drinking more water, eating more fiber, and a stool softener. When this fails, surgical indication may be considered. Internal hemorrhoids are generally treated relatively easily with rubber banding. External hemorrhoids can be surgically removed, but this is very painful. Acutely thrombosed or clotted hemorrhoids can be drained in the office and the clot removed. How are hemorrhoids treated in the office? The day of the exam, a Fleet's enema is given at home. This cleans out the anal vault. A small scope is then inserted into the anus and the hemorrhoids are identified. In an internal hemorrhoid, a rubber band ligation is completed. An external hemorrhoid is identified then several other recommendations can be given. The rubber band will fall off in about a week and is used to treat internal hemorrhoids. The procedure is usually uncomfortable, but not particularly painful, and usually takes less than 5 minutes. What are the risks of surgery? All surgeries have some degree of risks, but these risks would include but not limited to bleeding, infection, recurrent hemorrhoids, painful band application, or wound complications. Occasionally, difficulty voiding urine can happen. To contact Dr. Mario Leyba, call 505-727-7050 or go to the website at www.loveless.com/Mario-Leyba-MD.